Good afternoon, and thank you for joining us for our second town hall from Providence St. Joseph Medical Center. This afternoon, you'll be hearing from Medical Center leadership, Kelly Linden, our Chief Executive, Elizabeth Paxton, our Chief Nursing Officer, Juliette Marsh, our Chief Integration Officer, Dr. Howard Davis, Chief Medical Officer, and Dr. Angelique Campen, who is our physician leader and department chair for the emergency department here at our medical center. I want to remind you that this is a live event, and you will be hearing from each one of the leadership addressing some of your questions that you've provided in advance, and also filling you in on what has been happening in our medical center since COVID struck in March of this year. We are 6 months in, and we have seen a lot, as have all of you in our community. And I think that you will be very interested to hear what has been happening. I also want to thank you for your support. We have raised quite a bit of money with regard to our COVID fund to support our medical center and our heroes here at St. Joe's. In addition to that, we have received so many pieces of personal protective equipment as a result of your philanthropy and your generosity. Thank you so much. And I will now turn the program over to Juliette Marsh, our Chief Integration Officer. Thank you, Juliette, for delivering the reflection today.
Well, it's my pleasure to be able to be with you today. It is certainly a time during this season of 2020 for us to be mindful of who we are and who we continue to be called to be. I've been reflecting a great deal on the word Providence. For us, it is not a brand. It is not a sign on the side of a building. It is not only a way that we recognize a particular health system, but in Christian tradition, Providence is divine providence. It is another name for God, for the divine. And so for us to sit with today, I'd like to invite you to reflect on what this role of divine providence means for us as a community. As many of you probably know, the Sisters of Providence did not originally have that name. They were not originally called Providence. When Emily Gamlin, in her own moments of grief and angst after the very untimely deaths of her children and her partner, her husband, she chose to not take her grief and her suffering inward, but to take that grief and suffering and turn outward. And then as others came to join the community, their name originally was the Daughters of Charity, Servants of the Poor. Part of our mission and charism that certainly continues today in our care for the poor and the vulnerable. But as the people encountered these women, it was the community themselves that began to refer to them as Providence, because they knew that they were experiencing the divine in these women, the dignity, the compassion, and the healing love. So today I chose for you a quote which may also be familiar to you from Maya Angelou, because she reminds us that it's not just what we do, it's not just what we say, but it's also how we make people feel. And so she says, I've learned that whenever I decide something with an open heart, I usually make the right decision. I've learned that even when I have pains, I don't have to be one. And she reminds us that it isn't what we do. People will not always remember what we say, but they will never forget how we make them feel. And the Sisters of Providence made people feel that they were valued, that they were seen, that they were cared for. And that is why they came to be known as Providence. So as we continue to go about the work, 2020, as they say, is hindsight. And it's often with hindsight that we can look back and see where divine providence was at work. I have found myself, since I began here, using the word providential, that there are not coincidences as we might think, but that it really is part of our journey to be led by divine providence. So it's when we look back on our lives that we can often see these providential moments. And so I'd like to invite you, in a spirit of gratitude, to look back on your own journey, your own vocation, to think about who those pivotal people were for you, those pivotal moments where maybe only with hindsight can you see now that you were being led. The people who called forth gifts in you, who asked the question, have you considered doing this? Or I think you might be good at that. Resisting the temptation to think that divine providence is only at work in the good. It's also for us to look back and see the moments when we too were most vulnerable, when we were in pain, when we were devastated that things had not turned out as we had hoped. And to see that even in those moments of great vulnerability, divine providence was at work and leading us to the next step. So today, as we reflect on such an unusual year, I invite you to see in your own life where providential occurrences of losing a job in one place redirected you in a different direction. Then you never would have met this particular person. Had you not had this encounter, you would not be where you are and who you are today. To walk gently in those moments where you were wounded or vulnerable, and to be able to recognize that there was something providential at work. And to remember in the spirit of Maya Angelou, as the Sisters of Providence and the Sisters of St. Joseph knew so well, that it isn't always what we say or what people say to us. It isn't always what you do or what others have done. But there's a beautiful way in which people will always remember how we made them feel. And so we want to be able to honor that today, to recognize that we continue this heritage and this mission to continue to be a loving, divine, providential presence in the world. So thank you for your time today, as is our tradition, to ground us in this moment.
Juliet, thank you for that beautiful reflection and for sharing with us the story of our sisters and the work that they've done in this community. And when I think about providential and providence, as you've said, I also think about our community and how this community has given back so much to us here at St. Joseph's. So I'm Kelly Linden. I want to thank you for joining us for the town hall today. We are looking forward to sharing a little bit about what's going on in the ministry and the hospital and the work that we're doing, some of the changes that we have incurred, and where we're going as we move forward during this unprecedented time. I'm joined, of course, with Dr. Angelique Campen, who has been with our emergency department for more than nearly 20 years, I should say, not more than, and has been a physician leader and an incredible supporter of the work that we're doing, along with her Burbank Emergency Medical Group. Elizabeth Paxton, our CNO, Chief Nursing Officer, who's been with us just over a year now, doing incredible work to support the nursing care within the hospital and all the work that is being done to advance the ministry. And Dr. Howard Davis, who is our Chief Medical Officer, also been with us for just nearly over a year now, and supporting the work that we're doing in partnering with our physicians and continuing to move the various initiatives forward. I wanted to take a moment to tell you, before we get to our topic of COVID and where we've been and what we're doing, I wanted to take a moment to tell you a little bit about the ministry and some of the success we've had. This, of course, has been a unique time filled with a great deal of challenges, and yet we've had some wonderful successes that I wanted to share with you. The first is that over 4 months ago, we were recognized as a magnet facility. What that means is it is really a reflection of the extraordinary nursing care that we provide to our patients and the support of their families. Magnet is a designation that takes several years to achieve. We went through that process, and then we're notified that we were successful in that accreditation and recognition. Only 8% of the hospitals across the country have magnet designation, only 35 hospitals in the state of California. So this is really an elite group, and we are really very proud to be a part of this. And I'm thankful for the leadership team and the nurses and the collaboration across the entire hospital to have this come to fruition. The second thing that we did that was a significant accomplishment was to become a comprehensive stroke center. Now, many of you know that we have a very robust and comprehensive neurosciences program. We provide care for our community for stroke care and have been doing that for a number of years. We are what is called thrombectomy ready. That means that we are capable of doing the clot busting, and when the patient comes into the hospital that needs immediate intervention, we are able to do that. We also administer medications to alleviate the stroke as quickly as possible. And we have extraordinary efforts underway and a really advanced clinical team and equipment and capital to support this function. Through that work, we did become a comprehensive stroke center, again, and part of a very elite group. And we are recognized as well by the American Heart Association with the Gold Plus Elite Status Award for our stroke care. We also have been recognized this year again as a Best Regional Hospital. And then the Patient Safety Award and the Health Grades 100 Best Hospitals was also received this year. The Patient Safety Award, only 3 of our Providence hospitals had that designation. I'm really quite proud to have that because it is really about the care and safety of our patients as we advance the efforts and the programs that we offer to our community. So I want to change topics now and talk a little bit about how the organization has changed over the last number of months. As many of you may be aware, it was in the second week of March that we received our first patient, Mr. Greg Garfield, who was really quite sick. And it was during a time when we had not really identified all of the clinical protocols and processes that were necessary to care for our community. And I will tell you that our caregivers, our physicians, our leaders came together and streamlined and modified almost all of our processes so that we could care effectively for Mr. Garfield, as well as all the other COVID patients that would be coming our way there following. That work was really quite extensive. We had to really modify our procedures. We modified where and how we care for patients. There were a lot of changes in the emergency department, and Dr. Campen will speak more towards that. There were clinical teams that came together to identify the clinical protocols, the work that we did in the critical care unit. Liz and Howard will speak to that as well. Those changes were quite dramatic, and they added a great deal of expense to the organization. In fact, we have spent nearly $5 million in added expense just to care properly for our patients, for our COVID patients, but also to care for our patients that were not COVID. And we're going to talk a lot about that because I want you to be very aware of the fact that we have systems and structures in place so that we are keeping our patients safe, we're keeping our community safe, and we're keeping our caregivers safe. The financial impact to the ministry has been quite significant. Our volumes have dropped dramatically over the last several months. The reason for that is twofold. One, when this first did occur, we chose to not provide elective non-emergent surgeries initially, but we later learned that we could safely provide that care. And we also learned that patients were delaying their care, and so it was really important that we were here and available and let our community know that they needed to come and seek out care. But the result of that, we are $25 million behind in terms of net revenue and the dollars that we collected over since our prior year. That is a significant decline. That decline has come from a decline in inpatient and outpatient surgeries, a decline in admissions, much of that coming from the emergency department. Our emergency department volumes are down nearly 35%. Most of that is in outpatient emergency care that is the less acute patient. Those patients that are sicker, we are seeing a sicker population come to the hospital, but we have found that there has been quite a decline. That decline partly is because some of our medical groups and our urgent care centers and other facilities are using virtual health. And so what we've had to do is really let our community know that we are safe. We do provide our COVID care in a separate building that is designated for COVID. All other patients are seen in our other buildings. And those changes have really helped to segregate. And additionally, we have put all the procedures in place to care as well for those patients within the ministry, within the hospital. Now, one of the most important elements to all of this is to ensure that we can properly test our patients, the laboratory testing. And when we first started, we did not have the ability to do COVID testing. And so we had to outsource that. Those specimens were sent to Quest or LabCorp. The turnaround time for that could be up to 7 to 8 days. And since then, we've been able to bring in-house testing and quickly turn around that capability. The problem has been we've been limited by the number of patients that we could actually test because we have limited capacity. And so that limited capacity has precluded us from doing some of the outpatient procedures and testing that we needed to do. We have since been able to modify those procedures and have brought additional equipment in. And this equipment, I'm very pleased to be a part of Providence because with their leverage, our leverage, we were able to bring in what's called the Abbott Alinity M. It's a very large piece of equipment that can test upwards of 900 procedures tests a day. We are the hub for our LA and Southern California hospitals. And so by having that capability, we've been able to expand our capabilities throughout the region, which has been very important to us as we care for the communities that we're serving. One of the things that has been really important is that we have had such extraordinary support of our community. And I think I was able to share this with all of you in our last town hall. The outpouring of love from the community, the financial support, the offering of food, the personal protective equipment that Renee spoke of earlier, all of this has been so valuable to the work that we're doing. And in addition to the equipment and the financial support, it was really that demonstrative care that the community offered to our caregivers, to our nurses, our physicians, because they were really made aware of how much the community supported them for the work that they do. And that financial support has been significant. Nearly $400,000 has been raised in addition to the continued work around the emergency department. As you are all aware, we are building a new emergency department. We're very excited about that work. That work continues to advance. We were concerned initially that there could be adverse implications on our timelines. We have not seen that. That has not come to fruition. Instead, we are on track. We are on schedule. We continue to move that project forward. That $78 million has been, continues to be our project budget. $65 million has been raised by the community at this point. It's really extraordinary how much support we've received, and that work continues. The plan is for our urgent care center to be online at the end of 2021. That continues to be on track, and the emergency department to be online in the summer of 2022. That those facilities will help us to better care for our patients. We've in fact made some modifications to the project to address concerns around COVID, and I think Dr. Campen's going to talk a little bit more about that as well. But that project has gone very, very well, and we are thankful for the community and the work that you've all done to support us. So with that, this would be a great opportunity for me to turn it over to Dr. Campen. As I had mentioned before, Dr. Campen has been a part of Burbank Emergency Medical Group for I think nearly 20 years now. She's a physician leader with their group and with our emergency department and services that we've provided. She's been an extraordinary spokesperson during all of this time of COVID. I hope many of you have heard her on KNX and seen her on the news. But we are so thankful to have your leadership and to have your support and knowledge as we have navigated through this. And with that, I'll turn it over to Dr. Campen.
Thank you, Kelly, and thank you for leading us through these really unprecedented times. So I wanted to kind of give you an update of what's going on in the emergency department right now during these times of coronavirus. I just left the department an hour ago after finishing my shift this morning. I must say that in my 20 plus years of practicing medicine, I would never have imagined that I would be practicing in this manner. It's very, very different. Most physicians are able to practice because we have all the answers. We have the research, we have the background, we have the studies. This is a time where we are learning, we are waiting, we don't have all the answers. So it's really been a wonderful community here at Providence to collaborate with our infectious disease experts, our pulmonologists in the intensive care unit to really come up with the state-of-the-art treatment protocols that we are using day to day in the emergency department. As Kelly talked about in the beginning of the pandemic, our volumes were significantly affected in a way that you would not predict. We were seeing about 50% of the patients we normally do. And in the beginning, this was fortunate because our practice is very different. I would have never thought that I'd have to gown up each time I go into a patient room and see a patient and then come out and very carefully take off that protective equipment and then repeat for the next patient. This has affected our patient throughput. But fortunately, we have now become comfortable with all of these processes and more streamlined. The good things that have come out of this pandemic are really the camaraderie that has become evident in our department. All of the caregivers working together, protecting each other, protecting our patients, the sharing of information and ideas with the rest of the experts from the hospital, and also the outpouring of thanks from the community, not just the meals that have been delivered, but early in the pandemic when supply chains were hard for the protective equipment nationally, to see the resources and the efforts coming from the community to help keep us safe and to donate to the Heroes Fund at St. Joe's. Through that fund, we've been able to get equipment that has really helped us in the emergency department. So for example, we have an ultraviolet machine that helps us to sanitize and more quickly turn over an emergency department room. We had to come up quickly with physical changes to our department in order to keep patients safe. We had to create negative pressure rooms to help filter the air and not return it back to the department, but release it outside of the hospital. And so all of these processes that we needed quickly in the beginning were made available through the Heroes Fund. So thank you for that. I will share with you that in the beginning of the pandemic, I was very afraid. I was afraid that I would catch the virus, that I would bring it home to my family, how it would act in my body. But I'm proud to share with you, I'm no longer afraid, because in all these months of taking care of hundreds of coronavirus patients, neither I nor a single healthcare provider from Burbank Emergency Medical Group has gotten sick from coronavirus. And I think that just shows you the power of using your resources, the protective equipment, the information that's available out there to keep you safe, and the processes and protocols we put into place in the emergency department quickly to help keep everyone safe. I really want to impress upon everyone that it is safe to come to the emergency department. We are starting to see a return of our volume, thank goodness, but I was very concerned about people that were delaying care. Every person that comes to the emergency department is screened the second they walk through the door by a nurse. Every patient is isolated and treated as if they have an infection. We have plenty of protective equipment that we use every day. And every patient that's admitted to the hospital, no matter what the diagnosis is tested for coronavirus. So that way we're able to keep all of our patients as well as our providers safe. We do have a variety, as Kelly talked about, of testing methods. But one thing I will share with you is our focus is not to be a screening point for the community. As important as that is, it's not feasible for what our true goal is, and that is to take care of both our sick COVID-19 patients as well as all our other sick patients. And so the testing that we offer is for the hospitalized patients, for sick people. We do it by a nasopharyngeal swab. We have a variety of testing methods that are here on campus where we can get a very quick result for those emergent situations that are going to the operating room or going to the ICU. We have a more semi-urgent process that gives us results in about 3 to 4 hours for patients that are going to be hospitalized. And then in other patients that we don't need an immediate answer, we have other modalities. I did want to share a little information with you about testing. If you were to be exposed, typically you would become positive in about 3 days after exposure. A lot of people ask me about antibody testing. We do antibody testing in the emergency department, but it's not a very valuable clinical tool for us. It is not what's used to tell us if you have active infection, and there's still a lot of information and research to be done about the value of your antibodies, how long they last, what type of protection they give you. So we still have a lot of questions waiting to be answered, and only time will tell us that. So I want to leave you with, we are here. It is safe to come to the emergency department. Please don't delay if you have any concern. We're here for the community, and keep wearing your mask and keep your hands clean.
Indeed. Thank you, Dr. Campen. Also, I'd like to remind those of you who are listening, if you have any questions for any of us, please type them into the chat. We are happy to answer those questions, and I will call those out as they come in. But in the meantime, we will now move to Elizabeth Paxton, our Chief Nursing Officer, who's been a nurse for over 20 years. We were so fortunate to have her join us this past year. She's done just a tremendous job as we have continued to advance the clinical excellence of our hospital and the services that we're offering. Liz is going to talk about some of the things we've done within the hospital to ensure that it's safe, including our screening protocols and the work that we're doing in critical care and on our nursing floors. Liz?
Thank you so much, Kelly. It's an honor to be here today to speak with you. I wanted to talk a little bit about the preparedness we've had in the hospitals. When we talked to you before, we had just started our work with COVID, and just to remind you some of the measures we had put in place. As Kelly mentioned before, we do have the luxury of having our COVID patients in one building, and that is a very good thing for us. Because we had extra space, if you will, we were able to add on additional ICU beds as well as additional med-surg and tele beds to take care of the influx of patients. Fortunately, we did not see a huge influx of patients as other hospitals have seen. We've had a steady census of patients. The most patients we've had since March ranged around 50, and since about the beginning of May, we have averaged anywhere from 20 to 30 patients per day, with our average slightly dropping in the last month, averaging 15 to 20. So we are seeing patients not so much in the hospital as much as we had before. So that is a great thing. When we first started with COVID, we had tents outside the ED to manage triage and manage the visiting that we had. We've now been able to move that process back inside, and as Dr. Campen said, set up screeners. So once people walk in the door, they're screened and can be seen immediately. We also have screeners at our front entrance that screen everyone who walks in the building, whether it's a physician, an employee, a vendor, anybody that is coming to the hospital, so that we are testing every single person that walks in the door. Also, when this started, we started our command center, and so there is a nationwide organization through FEMA that helps us set up hospital incident command centers, and we've had our incident command center since March 5th, and it was very providential to Juliet's reflection today that we set that up on March 5th, and Mr. Garfield came on March 6th, being our first patient. So the command center is very important for us to help organize communication, resources, and any other things that we need to do as an organization. We still have our command center going at this point, and that helps us, again, manage our communication and our resources, and it also helps us as we communicate with the command center regionally for Providence. We, as Dr. Campen said, have been very fortunate to have many donations of PPE. We have not run low of PPE since early March. We've been able to supply PPE to all of our staff and any visitors that we've had, so that has been very helpful. Another safety measure that we put in place were safety monitors, and we still have these today. Safety monitors are stationed in different parts of the organization where patients are, so that they are watching people don and doff their PPE. So we are ensuring that people are doing that in the right steps. You wouldn't think it's so hard to put on gowns and gloves and masks in an order and take them off in a certain order, but it can be very stressful. And as Dr. Campen said, going from room to room to room, it does take a lot of time. But this has been an important piece for us. We also have lots of cleaning protocols in place to help clean high-touch surfaces in between patients. And so our care has taken just a little bit longer because we are instituting many cleaning protocols. As Dr. Campen said, we have seen more patients in the ED, but the patients in the ED have also been sicker, and so our admissions have been more ICU level patients than med-surg patients. This has definitely made an impact on the ICU as we take care of sicker patients that are in the hospital a little bit longer, and so that does tend to back up our ICU just a little bit because we're trying to get patients out of the ICU sooner. Our staff has done very well with COVID. It is very hard work, donning and doffing in between patients every single day, going room to room, wearing a mask all day. It can be very exhausting, cause dehydration and other symptoms, but staff has been really good at ensuring that protocols are followed, taking care of themselves. It does create an emotional toll for staff to have to do this every single day and really understand the toll it takes on their families, their patients that are here without visitors. So we've been doing a lot of work around resiliency and stress training. Overall, I think our COVID experience has been, if you want to call it good, as Dr. Campen said, it has created a lot of collaboration. It has created a lot of camaraderie. We've been challenged in new ways to think, and so it has brought us together more as a team than I think in the past we wouldn't have had that experience. This has really affected everyone who works in the building, from the greeter at the door to the CEO. So we've all had to think differently and do things differently to make sure that our patients are well cared for. Kelly mentioned earlier Greg Garfield, our first patient, and we've had many, many patients come through our doors. And I want to share another story with you about a patient named Julian Chan. Mr. Chan is a 49-year-old man, and he was with us for approximately 70 days. He was COVID positive. He came to the hospital with 2 pre-existing conditions. He was overweight and had type 2 diabetes. Mr. Chan is Hispanic, and if you keep up with the news, Hispanics are harder hit with infections than other populations. Mr. Chan was on a ventilator for about a month through a tracheostomy, so he had a tube in his throat to help him breathe. He experienced renal failure. Some of the treatments we were able to provide Mr. Chan when he was here was he was one of the very first patients we had proned, which means he was flat on his stomach, which is a little bit unusual in the hospital, and it took about 11 people to get him into this position and get him positioned the right way. He was able to have convalescent plasma, and that means plasma was donated from someone who had recovered from COVID. So that helped his recovery as well. He was also on blood thinners and an Li6 inhibitor, which helps reduce the inflammatory symptoms. And Dr. Davis will talk a little bit more about these treatments with his discussion. But Mr. Chan was, like I said, here for approximately 70 days, and his pulmonologist saw him last week and said that he is getting stronger and doing better every day. The most unusual thing that happened to Mr. Chan is he left our care without diabetes. And so he no longer has diabetes. And, you know, I don't know that we can necessarily relate that to COVID, but it is a positive silver lining after he was here for so long, being so sick. You know, type 2 diabetes is certainly around weight-related issues, and Mr. Chan lost a lot of weight while he was with us, but he also has recovered from his diabetes and is recovering very well from his COVID. Moving forward, we're hoping to get to post-COVID life sometime in the near future, but we are seeing changes every day, just like we saw changes every day when COVID first came out. About 2 weeks ago, we started allowing non-COVID patients to have one visitor, and that has made the world of difference for our patients. People are able to have their significant other here during the recovery, and it has just been a very heartwarming experience. It was very distressful for the families, the patients, as well as the caregivers when we were not allowed patient visitors at all. And so this has been occurring. Unfortunately, we are not allowed to have visitors in the ED due to the fact that our ED is very small and we cannot maintain social distancing. So I certainly want to thank everyone for the monies donated towards our new ED, because that will be great in the future. But we also have a separate entrance for our OR pre-op visits, and so that directs people through a certain door where they're not having to go through the hospital. So life is getting a little bit back to normal, which is great. As I close, I just want to remind you that flu season is coming soon. So remember to get your flu shot. And as Dr. Campen said, make sure you're washing your hands, you're wearing your mask, and you're practicing social distancing. Thank you so much for your time today.
Thank you. Dr. Campen, before we move to Dr. Davis, one of the questions in the chat is wearing a mask more beneficial for me or for those around me?
Great question. So wearing a mask, I will liken to a spit catcher. So what it does is it protects the people around you. It does not act as a filter. It is not a protection for yourself. So what I will add to that is to keep yourself safe, do not approach or be within 6 feet of anyone who is not wearing a mask.
Thank you. So now I'd like to turn this over to Dr. Howard Davis. Dr. Davis is our Chief Medical Officer. He's been with us for the past year. He works with both ourselves and Tarzana Medical Center. We are really fortunate to have him as part of the team. He, in his past, was actually an emergency physician as well, and has a great deal of clinical knowledge and experience, and has been a great partner to our physician leaders and clinicians within the ministry. Dr. Davis, I'll turn it to you to talk about vaccines and the treatment protocols and the various things we have going on in the ministry.
Thanks, Kelly. Before I get to that, I just wanted to add to what Dr. Campen was saying about how we're really fortunate that none of the caregivers, or very few of the caregivers, have turned positive or become symptomatic with COVID. But you know, when this whole thing started back in March, we didn't know that. And there was a lot of fear among the caregivers and in all areas of the hospital. And I really want to call out, you know, some of our medical staff leadership, because not only did they help us with the planning and the success of the way we were able to isolate these patients into our South Tower, but they really stepped forward and took care of these patients. And at the time, it was the thinking was at possibly some risk to themselves. So, you know, and these doctors really, it's our intensivists, you know, our pulmonary doctors, our hospitalists, and our infectious disease doctors. Those were the ones who really took care of these patients. But also some of our surgeons, you know, Dr. Sharf, who was doing tracheostomies on some of these patients, Dr. Najibi, who was placing vascular access dialysis catheters, and Dr. Conrad, his partner. You know, I think at the time it was very courageous on their part, and of course I don't want to leave out our ER docs, who were really sort of, you know, in the front line of taking care of these patients. So, you know, I think we can you know, be thankful that everyone has come through this. It's not over. It seems to be declining. You know, but I think we have a ways to go. So some of the things that we've done, you know, once these patients get out of the emergency department, we have to place them, and as Liz mentioned, they get put either in the COVID area or the non-COVID area. And then within the COVID area, which is our South Tower, we have various levels of care. You know, there's an ICU there, and there's also a lesser levels of care for the patients who aren't as sick. And you know, the other interesting thing that's happened is we never really dealt with this before, so there was no evidence-based that we could base our treatment. You know, initially we thought these patients had ARDS, which is acute respiratory distress syndrome, which is a well-known syndrome. We treat that with intubation, placing patients on the ventilator. But it turned out that this really was either not ARDS or a very different type of ARDS, and these patients didn't get better very quickly on the ventilator. So our treatment focus really sort of changed, and the idea was let's do everything we can to keep patients from getting on the ventilator, and all sorts of treatment protocols have been established, you know, based on really empirical evidence. So for example, one of the things that we found just sort of empirically was that placing the patients on their stomach was effective. It's called proning. So even in the emergency department, when the patients come in and their oxygen levels are low and they require supplemental oxygen, we put them on their stomachs for as long a period as possible. And certainly in the ICU, they're placed on their stomach. We also are giving the patients remdesivir. You've all read about remdesivir. That's an antiviral. So we like to give that as early on as possible. And luckily, the region, the Providence, Southern California region, has been able to obtain quantities of remdesivir, which they dispense to us. And so far, a large number of patients have received remdesivir. The other treatment that we've given is plasma-specific, COVID-specific plasma, which seems to help combat the virus, and that's harvested from COVID positive patients. And doing all those things and adjusting our treatment protocols based on serum markers, we've been able to really reduce our mortality rate to the point where our mortality rate is better than the national average. And we've treated probably either the second or third largest number of patients in the Southern California region for Providence. The other thing we've been able to do is, because we've been able to isolate the COVID patients so successfully, is we've really been able to provide surgical services in a safe manner. So our OR is operating at almost full capacity. We test every patient before 3 days, and now it's 5 days before they have their procedure, and then they're isolated for that 5-day period so they don't catch the COVID virus in between testing and the procedure. And actually, a lot of patients, it sort of motivates them to have their case done, because they do get a test. They do get to get tested before they get the procedure. So that's done really well. We have procedures in our operating room where we clean the operating room. We do terminal cleans if we happen to do an emergency case on a COVID patient. And so far, we've had lots of success in protecting our surgical patients. And except for the other treatment protocols that we have available to us, that we really haven't used very much, is a technique called Ecmo, which is extracorporeal membrane oxygenation. And what that is really, it's sort of a heart-lung machine that we have available to us. Fortunately, only one patient really has been on Ecmo that we've had since COVID began, but we do have that capability. So like I said, things are seeming to wind down. Hopefully, we won't have a surge in the fall. We're anticipating a lighter than usual flu season. And flu is different from COVID. Influenza is a different virus. And we're going to be starting vaccinating our employees very soon. And we're really trying to get people to undergo vaccinations, influenza vaccinations, like they normally would for the flu season. Certainly, you don't want to get both the influenza and COVID. And eventually, when we do have a COVID vaccine, we will, probably be encouraging both types of vaccination. And you also probably know that there's 170 COVID vaccines out there undergoing various stages of testing, and there's probably a handful, maybe 7 or 8, that are in phase 3 trials. So I think we can anticipate a COVID vaccine shortly. That's all I have. Thanks, Kelly.
Thank you. So, Howard, would you speak a little bit more about how long, and I'll also ask Dr. Campen a similar question, but if we don't have a vaccine, let's say until maybe next summer, do you anticipate that we're going to continue to see this moderate volume of COVID? Do you anticipate a resurgence? We're all trying to predict the future, and as we look and think about our next 12 months, but the community is asking, what does this look like to us? And I've got my thoughts, but I'd love to have the physician input if you don't mind. Dr. Davis, I'll start with you, and then Dr. Campen.
Well, I don't know if you want my thoughts, because every time I've made a prediction about COVID, I've been wrong. And this virus.
Most have.
What's that?
I said most have. That's true.
I mean, this virus is continually surprising us, and you know, like a few months ago, we thought we had seen the downswing, you know, and then all of a sudden we get a resurgence, and just when you think that it's going away, it comes back, and it may not even be the same virus. You know, there seems to be different viruses or different versions of the same virus, because some people, you know, it seems to be more contagious in certain areas and less contagious in other areas, and also it seems to hit hotspots. So again, you know, I think whatever statements that I would make about the virus, probably you could take them with a grain of salt. Angelique, what are your thoughts?
I'm happy to share my thoughts with you, and I share the same sentiment. Anyone that thinks they can make reliable predictions about this virus is likely wrong. What I do know is, if you look at what we've learned in the last few months, it's been huge. And simply to have some patience that we are continuing to study, we are continuing to learn, we are continuing to get more and more information. The fortunate thing is to keep yourself safe. It's not like you have to do something difficult or dangerous. You don't have to take a medication that has a lot of side effects. All you have to do is wear a mask, follow the recommendations of avoiding large volumes of people, physical distancing, and keeping your hands clean. I can do that, and you can do it too, and you can keep yourself safe.
Thank you. I'll share one of the reasons that there's a suggestion that we might have a light flu season is because we are doing all three of those things, and that is protecting us from other infections as well. And it's really important that you do those three things. And to Liz and Dr. Campen's point, I think earlier, is that you do get the flu vaccination. It's important for yourself so that you protect yourself from the potential of getting the flu, but it's also important for the hospital. We do not want any of our hospitals to be overwhelmed with a large number of flu patients or COVID patients. And so it's really important that we all do our part to take care of ourselves and to take care of the community. So one of the questions that came up is that some have noticed that we did take down the triage tents, or we moved the triage tents. And I'm wondering, Liz, if you wouldn't mind speaking a little bit to that change in process and why we did that. What's changed, and why do we not need to use those tents today?
Sure, Kelly, I'm happy to respond to that. What has changed is the way we actually see our patients. We're able to screen our patients sooner so that they're being seen right upon arrival. And we're also not seeing the amount of patients that we saw in the beginning. So we're not overwhelmed in the emergency department as we were before. This has allowed us to return to more normal processes, and we're able to identify our patients quicker. Testing comes back quicker, so we're able to separate our patients and see them in different parts of the emergency department. And I don't know if Dr. Campen wants to address that as well, if there's something she'd like to add.
I think you covered it.
Okay.
The last question or response I'll provide is for one of the questions. They asked the question about St. John's, a study from St. John's around vaccination. What I will share with you is that I am really thrilled that we are part of Providence, because we do have a large, very comprehensive research arm, both in our Oregon hospitals, as well as St. John's, and here within Burbank and elsewhere, we do participate in clinical trials. Those trials are all very important to advancing new clinical research, but also to advancing this work around the vaccinations. And so, as Howard mentioned a little bit earlier, there are a lot of trials, a lot of things going on, and we will participate in everything that we can to help to support this need. Dr. Campen, do you have anything else to add around vaccinations beyond what Dr. Davis or myself have mentioned?
I'm proud of all the work that's going into vaccines. One thing that I will add that you need to weigh carefully is the safety of a vaccine is its effect over time and the way that it affects your immune system. One thing I will add, though, about such as with antibody protection is even when people's antibodies have gone away, you have other parts of your immune system, your B cells, your T cells, that still have memory and still offer protection. So even when you test and you no longer have antibodies, you still may have some long-term protection. And we're hoping that that applies for coronavirus.
Thank you, that's helpful. I think now I will turn it back to Renee, but before I do, I want to say thank you to the community again. Thank you for your support over the 76 years that we've been here in Burbank and supporting the surrounding communities. Thank you for your current support, for your care of our caregivers and physicians and providers. And thank you for your financial resources, the support of our emergency department, the support of our St. Joe's, our Heroes at St. Joe's Fund. It has been extraordinary, and I'm very thankful to be a part of this hospital and a part of this community. Renee?
Thank you so much, Kelly. And thank you to everyone who was listening today, and thank you as well to our panelists. It is so wonderful to have these clinical medical experts here at to be able to brief us on what is happening. I hope that we answered all of the questions that you have had that you sent to us in advance and those that you had sent to us during our town hall today. Again, thank you for your philanthropy. Thank you for your support. We are your hospital and we are here for you. We are recording today's town hall and we will email it out to all of you as well. If there were any questions or anything in particular that you would like to have answered, please do not hesitate to respond to that email or contact me directly, and I will make sure that one of our medical experts will be able to respond and get back to you. I hope you have a wonderful afternoon. Please stay safe, be healthy, and listen to your doctors and the nurses. They know what they're talking about. Thank you, and thank you, Kelly, so much for your leadership during this time. Goodbye.